Hi everyone, my name is Tien. Today I will talk about Addison disease. Introduction. I came from Vietnam and I live in Tacoma, Washington. I obtained my BSN at WSU and here I am again pursuing my graduate degree. Our learning objectives are to describe the pathophysiology of the Addison disease. You will be able to identify and describe the influence of the environment and or gene on the Addison disease. At the end, you will be able to recognize signs and symptoms and provide appropriate diagnostic tests and treatments. Before we dive into the Addison disease, I would like to briefly go over the endocrine system. We had a lecture on the endocrine system in week 7, so this is just a brief overview. The endocrine system includes the hypothalamus, pineal gland, pituitary gland, pancreas, ovaries, testes, thyroid gland, parathyroid gland, and adrenal glands. Um, the functions are to produce hormones that regulate metabolism, growth and development, tissue function, sexual function, reproduction, sleep, and a number of other functions. And today we will look at the hypothalamic pituitary adrenal axis. We all already know that hypothalamus is the master gland which produce a number of hormones um, to regulate the endocrine system, and the hormone we'll look at today is corticotropic releasing hormone (CRH), pituitary gland, which had two parts, the anterior and the pituitary, and the posterior pituitary. The anterior, we will look at the adrenocorticotropic hormones, and also adrenal glands have the cortex and the mid medulla, which produce androgens, corticoids, and mineralocorticoids, and the medulla produce stress hormones, for example, epinephrine and norepinephrine. So the hypothalamus produces CRH, which stimulates cells within the anterior gland to secrete ACTH, which travels to the adrenal glands to produce corticols, glucocorticoids, and androgens. So, in a normal function, we know that increase of the adrenal hormones in the circulation will have a negative feedback on the hypothalamus to decrease or to stop releasing CRH, which decrease the ACTH. So, what are the functions of the adrenal hormones? The functions of the adrenal hormones are very critical in maintaining our body's homeostasis. For example, aldosterone is primary in mineralocorticoids, which works on the kidneys to retain sodium and water. As a result, an increase in the blood pressure. Cortisol in the glucocorticoid hormones has a variety of functions, for example, breaking down proteins and fats, bone activities, immunosuppression, or anti-inflammatory, increase blood glucose level, promote gluconeogenesis, weight gain as a result, and stress response. I also attach a picture of the short-term stress response and long-term stress response in this slide, and you can see here. Also, estrogen has a minor role in males and females. So, Addison disease, it was named after Thomas Addison, who first described patients affected by this disorder in 1855, and in the book titled On the Constitutional and Local Effects of the Disease of Suprarenal Capsule. The disease often occurs in the adults from 30 to 60 years old and more common in women. However, it can appear anytime. The primary cause is the immune system produces auto antibodies that attacking the adrenal glands mistakenly. Um, Also, within the glands, we have the enzyme 21 hydroxylase also attacking the glands, causing damage. So, um, when the disease happens, um, the negative feedback is off because of the decrease in the adrenal hormones. As a result, the hypothalamus produces more CRH, and that stimulates the anterior pituitary to screen more ACTH. Other causes of the Addison disease are the environmental factors, for example, radiation to the pituitary or hypothalamus regions. Tumors can be in the adrenal glands, hypothalamus, or pituitary gland. Dysfunction of um, one of those glands, dysfunction of the HPA axis. Infections, for example, TB is very common cause of Addison disease in the developing countries. Infiltrative diseases and genetic factors, for example, APS type 1 and APS type 2, which are described in the textbook very well. We have 5 stages of the Addison disease. You can see that genetic risk and environmental risk are related to the Addison disease from stage 1 to stage 2, and symptoms don't appear until stage 4. So keep this in mind why it's difficult to make early diagnosis. Signs symptoms, like I said on the previous slide, that they don't appear until stage 4, and the signs symptoms include anorexia, weakness, fatigue, and GI symptoms due to the GI decomposition, the compensation, hyperpigmentation due to the increase of ACTH, hypotension, sore crave, posture, dizziness, vertigo, and muscle and joint pain due to the decrease of um, aldosterone. Um, and the signs and symptoms are gradual and worsen over a period of years, making early diagnosis difficult, like I already said earlier. Diagnosis, we have a number of diagnoses. We can use blood tests, for example, sodium and potassium, because of the decrease in aldosterone, um, which cause a decrease in sodium. Cortisol gonna be decreased, and ACTH blood levels, it will increase due to the body response to the low um, production of cortisol. We can also use the immunologic test to measure the 21 hydroxylase antibodies um, to distinguish the cause of Addison disease. We can also use the imaging, for example, to see if there are tumors or hemorrhage in the adrenal hormones or pituitary glands or um, hypothalamus. And treatments include lifetime glucocorticoid and mineralocorticoid replacement, and also the modification of diet and and multiple correction, for example, electrolytes. educate the patient to not miss any dose of medication and the reason why they should take it every day. Monitoring. Here's a reference, and if you have any question, please email me. And thank you for listening.